about Symbicort inhaler and the proper use of it. Someone here may have asthma or COPD, or you may know somebody that does. The proper use of the inhaler is very important. It could save your life or somebody that you know. In 2015, an article was written by Brands, Osawa, and Ghazi about a recent study that showed 7% of asthma patients use their inhalers correctly. Of those that use the inhalers incorrectly, more than 60% missed more than 3 steps. As an emergency room nurse, that study was kind of startling for me. I teach patients every day about the disease process of asthma and COPD. I also educate them on how to use their inhalers. Excuse me. Proper use can greatly reduce the number of attacks and exacerbations from these diseases. And it's very important for these patients to understand that. At some point, we all have experienced what it's like not to be able to breathe. The patients that have asthma and COPD experience these situations very frequently, and it's very frightening for them. A 2015 Mayo site defines asthma as a respiratory condition of the bronchi of the lungs causing difficulty in breathing. It's usually triggered by an allergen of some sort. They also define COPD as a chronic inflammatory lung disease that causes obstructed airflow in the lungs. Pardon me. Symbicort is a maintenance drug. By maintenance drug, what I mean is it is not a rescue inhaler. It is a drug that's taken every day. It's prescribed by your physician. Not everybody with COPD or asthma will be able to take Symbicort, so you do need to talk to your physician about this. It will be taken, like I said, on a daily basis. It is not for emergent situations, but it is a medication that is used to reduce the number of emergency situations that will occur. Based on the Food and Drug Administration website of 2008, Symbicort is a long-acting bronchodilator. It's also a corticosteroid. It helps open the airway and helps patients breathe much better. At this point, I would like to educate you guys on how to use your inhaler. Your Symbicort inhaler will come in a box like this. When you open up your box, it will come in a package. You're going to open up your package and take out your inhaler. This part of your package can be thrown away. This insert is really just to keep your inhaler fresh, so you can dispose of that. It's not necessary to keep. This is really just the important part. You're going to open up your inhaler. You'll pinch both sides of the cover here, and it should just pop open like this. By placing one finger on top of your inhaler and at the bottom, you're going to just shake your inhaler for approximately 5 seconds. This will help prime your inhaler. At this point, you're just going to give your inhaler a puff here. This gets your inhaler ready for you to start using it. You're going to shake it again for another 5 seconds. Give one more puff. At this point, you can start using your inhaler. I am not going to actually take in the medicine, but I will demonstrate on how to use it for you. So you're going to put your lips completely around the mouthpiece. You want to make sure that you secure as much of the mouthpiece in your mouth as possible, so that when you do inhale the medicine, you're getting as much of the medicine as you possibly can. You're going to hold the inhaler upright. Point the part of the mouthpiece towards the back of your throat, so that when you inhale the medicine in, that it does go into your bronchial airway. So this part will go into your mouth. you're going to let go of your breath. As you take in a breath, you're going to take it in very slow, and then you're going to release the medication, just like I showed you, just by pressing down on the top. You're going to continue to breathe in, hold your breath, hold that medicine in your lungs for as long as you can, and then when you release to take in a breath, you can release the top of the medicine. So it'll look like this. So let go of your air, exhale, then inhale, hold it, and then release. You're going to repeat that process after 30 seconds, so you're going to take a total of 2 inhales of your medication. After that, you'll take your lid, secure it back onto your medication. Once you have completed your dosage, you will get a drink of cold water, swish it around in your mouth, and spit it out. This helps get rid of the residual medication that's in your mouth and in your throat. And this, if you don't do this process, you could develop a thrush inside your mouth, and that just helps get rid of that. So every time you take your medication, you want to make sure that you do that. So that is how you use your inhaler. If you have any questions, there is always an insert that comes with your inhaler. This will give you full instructions, and it will explain the whole process to you. So it goes through the step-by-step instructions. Comes inside the box. I would hold on to this just in case you need to go back as a refresher. What's great about being educated on the use of an inhaler is that you now know how to use a rescue inhaler as well, in case anybody needs to know how to use one. So I hope that you can benefit from this. I hope that you can use this information and teach everyone else. For anybody that doesn't know how to use an inhaler, you can share this information with them, and we can help everyone learn and hopefully avoid people having further exacerbations in the future.